closer. Okay. All right. Afternoon, church. Happy Sabbath, church. Amen. So I'm just going to do a brief presentation. I'll try not to take a lot of time because our therapist, Majita, has the practical aspects to therapy and prevention of substance use and also partly rehabilitation of patients who are in substance use. So I'll just try to go through the definitions and the basic things. We'll just keep things simple. Like I always say, it's always difficult for a doctor to simplify things. I'm glad we have some doctors in the audience. We have Dr. Promise there. Yeah, so I'll just try to keep it simple and not make it very complicated. Okay, so we are looking mainly at the issue of substances. Okay, be kind to your mind and asking for help. So because of mental, emotional breakdown or circumstances, people resort to many ways in order to feel good or to escape reality. Okay, this is how people end up using substances. Sometimes it's just because they want to experiment. I think I won't steal Marjie's presentation. She's going to go into that when she presents. Maybe experimentation, adolescence, and sometimes it may just be due to the fact that you are in an environment where the things are, maybe you're a medical doctor, you're a nurse, you're a pharmacist, and you are quite exposed to the substances and it's easy to use them. So substance abuse encompasses many substances. So we talk about substance-related disorders. So they are generally categorized into two. They substance use and they are substance-induced disorders. Okay, so a person can use substances, but they might not necessarily have substance-induced disorders. So the mental health effects now come about as a result of continual use of these substances. So in the morning we did discuss the different substances that are there. So the definition is the use of illegal substances like marijuana, cocaine, psychedelics, heroin, methamphetamines, which we know and they are quite prevalent in our setting. I remember the other day on a Sunday I was watching ZTV and there was a program which was there. Parents were very hurt and you know, expressing their emotions about how hurt they are about the fact that their children are abusing drugs. So it doesn't only mean that you are looking at the illicit or illegal substances, but it can also encompass the misuse of prescription medications. So normal substances can be used and that becomes part of your substance use and substance abuse. So even prescription medications, alcohol, nicotine. Then substance dependence comes about when one is addicted. Okay, so as we said in the morning, the body has what is called a reward system. We'll just keep things simple, not complicated. So that reward system uses a transmitter called dopamine, and that dopamine is the one that makes people feel good, okay? And most of these substances have a direct effect on the reward pathway. So let's say someone takes Mtoriro, it goes to the brain, activates the reward system, reward pathway, there's a release of dopamine, they feel good, they get that euphoria. And then eventually they get tolerance, you know. Maybe a good example is maybe using alcohol. If someone has been taking one or two to get drunk, they usually require more to get the effects because the receptors will end up being used to that substance. And then once you get tolerance, then you get to addiction. After addiction, when you miss the substance, you get symptoms of withdrawal. So withdrawal can present with anxiety, depression, even seizures, or someone just having fits like an epileptic person or patient. So that's just the general spectrum of substance-related disorders. So there are 10 main substances listed in the DSM-5 as the substances which are responsible for substance-related disorders. Number 1 is alcohol. Number 2, caffeine. Okay, so people tend to underestimate caffeine. People talk a lot about alcohol, but in the morning, for those who were there, I think I mentioned some examples when we were students. There are people, I think even up to now, when we are doing our ward rounds, when I ask some of my students, maybe they got a distinction in pharmacology, then they said it was because of Red Bull. Okay, so they take the Red Bull, caffeine, they don't sleep the whole night, they cram maybe the whole week, and then they do well in the exam. So that's also part of substance use disorder. There's caffeine addiction, caffeine withdrawal. So it's not just alcohol, it's not just marijuana, but caffeine is there. We know where caffeine is found. Then we have cannabis, hallucinogens. I think hallucinogens tend to be on the side of people who are more affluent or richer, things like lysergic acid, some psychedelics and so forth, which make you hallucinate. Okay, you take that and you hallucinate, you feel good, you just escape reality. Then inhalants, examples, inhalants, things like glue. I think we know that even when we're growing up, street kids are known to abuse glue. And I think recently, people have been abusing Pampers, I think, and maybe boiling them. I'm not too sure what they do, and then they inhale. But we can have more information from our therapists, Then opioids as well. These are commonly abused substances. Remember, these are medicational drugs, but they are abused by health workers and by patients who can become hooked on these. And as we look at opioids, we find the common opioids which are abused: morphine. Sometimes people just want morphine just to feel good because it gives you that euphoria, that feel good, and that can help you if you're stressed or just feeling anxious and worried. So people can just take morphine for addiction. Then there's fentanyl, then there's pethidine, and codeine. Okay, fentanyl, usually it's used in theater by anesthetists, and it's also used for after maybe cesarean sections for epidural anesthesia, and sometimes they use what are called fentanyl patches and so forth. So fentanyl is also quite addictive, and you find that some of the musicians or famous celebrities were also hooked on drugs. I think Michael Jackson died because of propofol overdose. It's another anesthetic agent, makes you feel good. Hypnosis, sedation, hypnotics and sedatives are also part of these substances. Prince also, I think it was a fentanyl overdose. Whitney Houston, it was another fentanyl overdose. So you see that even those who are rich are not free from substance use. It just differs that for the rich, there are other things they can use. Just last week or just during lunch, we heard that people are abusing Cerevita and Mazoe, and they are using it to prepare some form of a concoction, So just be careful. I'm not saying don't buy Cerevita for your children, but just be careful. People are becoming so artistic in terms of these substances, okay? So there are sedatives as well. Hypnotics, those are just mainly prescription drugs. Anxiolytics, drugs which help you to feel less anxious, and these are just mainly found in a hospital setting. Hallucinogens, we mentioned those, and tobacco. And we mentioned that addiction or substance dependence is a big problem, mainly because it activates the reward system. So once something activates the reward system, it has a very powerful effect on the mind, and it can lead to addiction and withdrawal in the absence of that stimulus or that drug. And I think now psychiatrists, unfortunately, we couldn't get a psychiatrist, but we'll do our best as non-psychiatrists. But they are still looking into gambling disorder, gaming. So all those things are coming in. There are people who go gambling and so forth. It's also part of those things which activate your reward system and can lead you to serious addiction. Growing up, I think we remember that people maybe used to bet for horses and so forth, and they were quite addicted. Some would win, and there was lotto. All those things, they activate your reward system, which is why even the word of God and the spirit of prophecy speak strongly against such things. And even when we read Ellen White's books, she also talks about stimulants, and the way she described the effect of stimulants is the same way which has been found out to be the effects of stimulants by medical people. So substance use, we mentioned that every substance has a potential to be addictive. So the best way is to avoid getting to that point. Once you get to addiction, it becomes a point of no return. But Majita will touch on that. Substance misuse, for example, is drug or alcohol consumption that harms the individual and their significant others in the community. I think we have seen this maybe as doctors, as relatives of patients or people who have abused substances. They start becoming violent, they start shouting obscenities and doing all sorts of crazy things. Then substance abuse is harmful or hazardous use of psychoactive substances, including alcohol and other illicit drugs. And substance use disorder is a pattern of drug use that leads to significant problems such as failure to attend work or school. So once you become hooked on substances and drugs, even your performance at school, at work, it becomes very compromised. Then there's this issue of dual diagnosis. So you find that it's very difficult at times to tell whether a patient has abused drugs because they are mentally unstable or they become mentally unstable because of the abuse of drugs. But we do know that stimulants, all these drugs, will lead to psychosis. So sometimes a person may be self-medicating and you don't know. They have their undiagnosed mental illness and they just want to make themselves feel good and they end up using drugs. So we know that mental health problems can be induced by drugs, but substances definitely cause and exacerbate or worsen pre-existing mental disorders. So why do people abuse substances? I think we've discussed this even during the sermon. Dr. Manungo talked about peace. So it can be used as an outlet for stress. Okay, maybe things are not adding up, you're stressed, the rate is going up, you don't have rentals, you don't have fees, you've failed your exam, you've had a heartbreak and so forth, you've lost a loved one. Unemployment as well, medication and relief of symptoms. And you also look at three factors which is going to touch on. That is the drug, the environment, and the individual, and you consider the occupation of the person if they have ready availability of the substances. So according to DSM-5, between 7 to 25% of people presenting with an initial episode of psychosis have substance-induced psychotic disorder due to substances or medication. So the highest risk is conferred by heavy use of marijuana, amphetamines, which are trending in Zimbabwe, South Africa, the different types. There are many different types of amphetamines, but here I think they call it mutoriro, guka, some call it nyawope, okay. Then we also have psychedelics and hallucinogens and cocaine. So these substances have a very high risk of causing psychosis, which is why we see that there is an increase in the prevalence or in the amount of people who have mental disorders because of the increase in use of all these different substances. I think cocaine is a bit upmarket, so you still find it in the richer people. They can access cocaine. It is available. It is there in Zimbabwe. So prescription medications can also cause these disorders. So these include different drugs, especially the opioids that we talked about, fentanyl, pethidine, codeine. I think you know codeine, it's found in Bronclear, and many youth are abusing cough syrups. Bronclear, they call it Bronco. I think even the late Soldier Love once sang about codeine. I think, in one of his rhymes. So this is how rampant this substance use is. And some people even say that before these artists perform, they actually take something, be it mbanje, marijuana, whatever, or guka, so that they just feel high and they can be able to make the crowd happy and they have no stage fright. Okay, so those are some of the substances. So when a patient or a person has substance-induced disorder, this is usually reported by family and friends because they are the ones who notice change in pattern of behavior. They just see that Dr. Manenji used to go to work every day. He's no longer coming to work. Okay. I think when we're growing up, people would just be seated by bridges, and I think you remember this, they would be smoking, they would be taking some substances of some sort, and then you see that, and then you notify either the police or you can notify the hospital. The Mental Health Act allows someone to be admitted even against their own will if they are a danger to themselves and to others. So if they become very violent and just come in church here, hit by substances, and then they start attempting to throw stones at everyone, or maybe to beat everyone up, or maybe they just undress in public, and then you're like, but this person is normal, they don't normally behave like this. So the individual substance is often, use of the substance is often heavy and long term. But let's also not remember that use of some of these things in the acute setting can cause someone to act psychotic. Okay, so if you take too much cannabis, marijuana, whatever, mbanje, you can actually seem like you're psychotic, but it's just response to taking that substance in the acute setting. And also, I think we're discussing the fact that people of today are very creative. I think adults or youth, people my age or younger, know that nowadays people make weed cake. Okay, so they'll be looking for flour, muffins, they put their mbanje in there. I remember seeing some patients, and later on they had to confess to their employer that, no, we actually took weed cake. They came in with very high blood pressures, 190 over 100. They were confused, they were hallucinating, but I think they were minors, so they wanted to, some of these jobs. Remember, we're talking about occupation, gold panners, these people who, mashurugwi and stuff, these people who just do violent things, they are at very high risk of abusing substances. So they came there, and then the employer had to pay the bills for observation, investigation. Then they confessed later on when the intoxication of the weed cake had gone off. Then they said, we took weed cake. So imagine, and I'm sure they didn't get paid that particular month. Okay, so patients present usually delusions, hallucinations. So hallucinations, you just start seeing things that are not there. Delusions, you start believing. I think you have seen this when we take the history. I'm sure Doc will remember. We ask, if you are using Shona, you just say, Munema Simba munofunga munawere. So these people become very delusional. They think they can pray for people, they can heal people. And I remember and recall one who said, I have a vision. I want to change the streets' names in Mavuku and give them to the names of all my best friends. So imagine, this is how people, they become so delusional. This actually happens. It may seem funny, but this is the extent to which substances affect people's brains. They become very delusional. So some delusions, when you're standing in front of people like me right now, then you think, someone has a gun, or people want to kill me. So you can have persecutory delusions, grandiose delusions, and so forth. All those different manifestations of psychotic disorder as a result of abusing substances. Hallucinations in all their shapes and sizes. You start seeing different things, small things, large things. I think we've heard stories about people who've taken substances in the acute episode and they've jumped off maybe flats and so forth just because they were intoxicated and they felt like Superman. You can even feel like Superman even though you're just a normal human being. So these symptoms usually they develop after use prolonged use of the substance or after exposure to a medication which is known to cause the disorder, and you cannot explain the disorder using another psychotic disorder. So there are many other psychotic symptoms, like we mentioned, or diseases that can cause people to lose their mind. For example, schizophrenia, bipolar affective disorder, temporal lobe epilepsy. They can just cause someone to have violent behavior, mania. They just are violent. They've increased energy. They can't sleep. We say they've reduced need for sleep. Okay, yeah. So they just do things that they normally don't do. So sometimes it's not a substance. It might be a pre-existing psychiatric disorder. But like we said, a person can abuse substances because they know up there they are not well and they want to self-medicate. And we mentioned the fact that when people abuse substances, then they have impairment in judgment. They have impairment in occupation and other areas of function. So how do you treat these people? Maju will discuss that. Rehabilitation and therapy. It's multidisciplinary. Psychiatry is involved. Clinical psychology is involved. Family and community intervention. This is by far the most important aspect. So the family, the nucleus, the heartbeat should be involved in supporting. The other problem we see in African culture pertaining mental health is people usually think mental health disorders are related to mamepo. Okay, they think someone has bewitched you, or they think all sorts of things. Vanoti aromba, or vabereki varomba saka mwana akupenga. I think you've heard that, and the parents wanted to have lots of money, so now this is a side effect manifesting in the child. The child has gone psychotic. So people have so many beliefs about psychosis in African culture, and they don't usually attribute it to substances, because one would say, this other person drinks lots of alcohol or takes lots of these substances, but they never get psychotic. So that's the other challenge we face. So you find that the patients, sometimes they present very late because they end up going via the contemporary route, contemporary medicine. They try their faith healers, Mapostori, they try prophets, and then eventually they come to the hospital. They also need support groups, and they need withdrawal of the offending agent. So you need to have a strong support group for these patients. But the challenge we've been facing currently is most of the rehab centers are very expensive. I think it would cost maybe $600 per month, if I'm not mistaken, or it's quite a lot of money you need, because Annex at Pari and Harare Psychiatry Unit and Chitungwiza would only treat when the patient is psychotic. But after the psychosis has been treated, you still need some form of rehabilitation, because once you discharge the patient, they are going to go back and get exposed to the offending agent. Okay. So what factors increase risk? We've mentioned this. Individual factors, family factors, conflict, dispute, social factors, genetic factors we've mentioned. Sometimes you have mental disorders which run in families, and if you take substances, you're increasing your risk of having psychosis. Contextual, violence, gangsters, we've mentioned gangsters, crime, poverty. Then in adolescence, we mentioned the fact that sometimes they just feel bored by the ordinary activities and they want to try something new. And they say, let's try this. I think we've heard the stories. I think recently it was Dominican convent where there was an outbreak of using drugs and so forth. So this is happening even in schools. Then peer pressure and fear of missing out, right? I think when we're in high school, we know there were people who would laugh at others and say, you've never tasted alcohol, you've never smoked a cigarette, something like that. So that in itself can increase the risk. Then we discussed the cycle, said dependence. Continuous use of the substance leads to dependence because you're rewarding a pathway in the brain and it's producing dopamine and you're feeling good, you're having euphoria. you feel good, like someone who's been given a shot of pethidine or fentanyl. I've never been given pethidine, but pharmacology textbooks will say that it's a very pleasant or euphoric. You just feel good if you get a good dose of an opioid. That's why you find that sometimes patients after accidents or after operations, they become addicted to opioids because they were being given opioids maybe for the first 2-3 days post-op. Then once they withdraw, they start having some withdrawal symptoms because they miss that euphoria that you get from the opioid. Then you get tolerance. You need a higher dose. Addiction. So once you're tolerant, you can overdose yourself to the point of death because most of these opioids will affect your respiration. Even propofol we discussed, which was taken in overdose by Michael Jackson, also affects respiration, and then your respiratory muscles just go silent and then you die. And usually you're alone taking the drug, IV drug at home, no one there, and then you go into respiratory depression and then you die. Then the withdrawal, we mentioned that. So I'll just briefly talk about, I think in a few minutes, the medical complications of alcohol misuse. So this is someone who uses more than 15 drinks of alcohol per week, and more than 8 if it's a female. So acutely, we mentioned, we know what happens when someone takes alcohol acutely. They get drunk, poor judgment, they can have accidents, risky behavior, acquiring HIV, sexually transmitted infections, and so forth, and they just say, I didn't even know what was happening. And they can get alcohol intoxication. So we should be able to distinguish between intoxication and substance-induced disorder. So if you take too much alcohol, we admit these patients every now and then. I remember the other week we admitted best friends who drank themselves to oblivion, and they came in comatose because of too much alcohol. Unfortunately, one of them didn't make it. So alcohol can intoxicate a person if you take too much. It affects your brain, depression of your central nervous system. It mops up your thiamine, your nutrients. You start getting what is called maybe nutritional deficiency. It affects your nerves. It affects your balance, what we call Wernicke's encephalopathy. You can actually be psychotic because of thiamine deficiency from using alcohol. Then you get Korsakoff psychosis. Then if you intoxicate yourself and you recover, I think you've been seeing, these are some of the factors that are fueling people to abuse substances. People are advertising lemonade. They call it lemonade. And I think you've seen those adverts on social media. This is jet fuel. So they are already advertising the prophylaxis for alcohol intoxication, because they are saying, go and drink your alcohol, you come to my bar, I give you lemonade or jet fuel. Okay, they are doing it. I think even at shows, doctors are even making money from that. They have a lemonade part, and UB40 is there over there, and people get intoxicated. Someone goes and gets their jet fuel. So alcohol mops up your nutrients, mops up your glucose, and it leads to quite deleterious effects. Then on the long term, it affects your liver. There's what we call alcoholic liver disease. Before it gets to cirrhosis, then you get liver cirrhosis, chronic liver disease. You start vomiting blood. You start having high blood pressures in your liver, what we call portal hypertension. Then it affects the heart. We're just keeping it simple. It affects the heart. You can get, I think we have so many cases of alcohol-associated heart failure. We call it dilated cardiomyopathy. So when you consume so much alcohol, it's going to affect your heart muscle, make your heart muscle weak, and then you get heart failure. Some patients come with dual diagnosis of liver cirrhosis and heart failure from lots of alcohol, harmful alcohol consumption. Nutritional deficiencies, we've mentioned this, thiamine. Then alcohol can cause ulcers, gastritis, and so forth, and it can cause pancreatitis, inflammation of the pancreas, both acute and chronic pancreatitis. It can also increase the risk of gout. People who take alcohol have a 3 to 4-fold increase of getting gout compared to people who don't take alcohol. Gastritis, then it can affect your heart rhythm. It's called the holiday heart syndrome. Your heart just starts beating irregular because of too much alcohol. increased risk of high blood pressure, strokes, poor performance, and depression, anxiety, and other mood disorders. Okay. Then acute consumption of amphetamines, I'm almost done, can lead to seizures. Someone can start fitting, delirium, they just come in confused, hypertension. I think we would see lots of these patients on our calls. They have consumed, the young patients, you see a patient 18, 19, 20, blood pressure is sky high. They have been hooked on Guka, okay? Amphetamines, just like alcohol, affect the heart, lead to heart failure, and they also increase the risk of stroke. Same thing with alcohol. You can get strokes, you can bleed in the brain and so forth. You can get psychiatric illnesses. So those are, and the manifestations of cocaine are just more or less similar to the manifestations of excess amphetamine. So it's the same: fitting, confusion, high blood pressure, bleeding, psychiatric illnesses, heart failure, heart attacks, and sometimes it can even cause someone to have air in the chest, what we call pneumothorax, or air in the mediastinum, because people will be snorting cocaine. And so when they do this, they try to increase the effects of the cocaine, so they will be coughing against a closed glottis, more like you're straining, so that you feel the effects of the cocaine. So that can affect your lungs and damage your lungs. You can even get blindness, sometimes blurred vision, and other complications. So I just tried to keep this simple, define terms, and the common substances. Of course, remember, this is a big topic. There are many other substances that can cause substance use disorders, but I just touched on the common ones, the ones which are affecting us, and we cited some examples of the new kids on the block, okay, Cerevita and Mazoe, the Pampers, and many other things. And just outside again, during lunchtime, I heard about Fuko, okay, that people are using Fuko to make a concentrated, which is just simple maheo. They brew it, and it becomes a concentrated alcohol, and it has been banned in prisons. So that's how bad the substance abuse is. People are just finding ways of making these substances. Even if you don't afford the expensive things, the hallucinogens, the whatever, you just try to make your own mixtures. Just on that point, I think we know what they called Musombodia. Again, some of those hymn dancehall people have sung about it and so forth. They mix it with some antipsychotic drugs, okay, which are actually used to treat psychiatric illnesses. And they want they call it kustika, okay? So the drug CPZ or haloperidol, it just makes someone a bit rigid, and they just want to sit there the whole day, akastika, and they are feeling good. And okay, that's something that's found in Musombodia and all these things. They have different names. There are other things called Mangemba and so forth. So they have different street names. So you have to know the street names and the different things that people can actually abuse. But the most important thing for us is not to be focusing on this medical jargon, but to focus on prevention. And once it happens, we have to be there to support our relatives, our friends, whoever it is, even the community, as we have a corporate responsibility as the church to help people who are hooked on drugs. So I think that's just a summary. I tried to do about 30 minutes. So the therapist, Majita, will touch on other aspects of substances. Then we have a question and answer segment at the end. So you can keep your questions, write them down, and then we'll hear the therapist speaking from the perspective of an occupational therapist. How do we approach these substance-related disorders? How do we help these people? And how do we prevent ourselves from getting hooked on substances? Don't forget caffeine. I know there are people who take lots of coffee here. So it's not just alcohol and these things. So please avoid using too much caffeine, chocolate, coffee, Red Bull, Coca-Cola, etc. And caffeine is also part, and it's number 2. There's what is called caffeine use disorder, caffeine withdrawal, headaches, and so forth. So don't forget caffeine. It's there, okay?
afternoon. I know we are very tired. I'm also tired. I actually felt like sleeping around lunchtime, but I knew I couldn't sleep. So before we start, I'm not sure if we can have maybe just a little something so that the people can make sure the food goes down. Okay, so we just need something to liven the people up and then we can start. Right? Perfect. Thank you so much. Okay, so it's more of a continuation from the topic that we had in the morning. Tazokatwa chinzi time ya kwana. Not sure tizvezvi ndinokatwa nguva because if you know me, you know that I talk a lot and I love talking to people. So most probably I'm going to be talking to you guys and asking you questions kana ndikastika. Okay, so for us to start right, in the morning we talked about crisis and we talked about trauma and how most of the problems that we have in mental health are usually caused by a failure to be able to cope with these problems that we have. But problems and stress are a common part of our lives, Anditi. So in them being a common part of our lives, how then do we choose to handle our problems and it? So what cripples us basically are two things, right? Where you are in life and what we have in life. So I see my good doctor there. This is a joke. So I have one friend of mine who always says, when he sees your car coming in, mira chete, fuel mira chete chete, handwanga ndabo, yemota yao. It's a secret. Anyways, so usually this is what cripples us because you're looking at things and you're thinking to yourself, I want to be here, but right now I am here. So usually this is what then leads to the mental health problems that we're talking about, right? So also, people also develop substance misuse problems because, but right before that, some of the things have been said. I might want you to tell me some of the things that you got so that it helps me to move to what I tried to create. So basically, these are a basic, we're trying to join the Bible, what we have already in the world. One thing that I love about books is it gives us a new perspective. Actually, it's not a new, it's a new perspective in the sense that we already know this. And we already know that we're supposed to do these particular things, but then we just need to find a way to structure it in such a way that our brain understands and can be able to register this, right? So we're trying to say to merge the Bible, we're trying to merge therapy, we're trying to merge what we have, what I thought was very good in terms of business acumen. I'm not a business person, but I read this book, like I said, from Napoleon Hill, and I loved how he articulated his thoughts, right, in such a way that I was like, you know what, if you come and try to find a way of articulating, because the brain is very structured, from what I remember from the brain, each and every part, let it be the frontal lobe, the parietal lobe, whatever it is, the occipital, there's a specific function that it has to do. So this is a very structured organ with a very structured purpose, right? So we need to give it a structured answer. I love the answers that we have where we are saying, I could come and say, for you to be able to maybe express yourself nicely, write a journal, write how you felt, but where am I getting this? I need you to have a basic understanding of the fundamental before I come and give you the what? Exactly. Before I say, I want you to go for a jog, I want you to do this, you need to understand why you need to be able to go for that jog before someone comes and tells you to go for a jog. Zvoita kunge uri kumanikidzwa. No, ndakazoenda vakanditi ndinofanira kuenda for a jog every day. No, 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 no. What is the reason why you're going for a jog? So, right, I need the reason why people develop substance misuse problems. Saka, oh yes, thank you. Yes, thank you. Anyone else? Yes. Yes, thank you. The gentleman, Timboyo, this side of the room. Yes. And I know I did what's been a kununga van. I got this one at Dr. Manungo Scotch Taras or Kudongo Shkongo Sakana microphone Banemun was Josh and Rukuda. Yeah. So I need, I guess, the gentleman here, just any example of what might lead people to have substance misuse problems. Exactly. Thank you. One more person so that we move on. Inini shangu ndiri kungotarisao ndichingofamba famba ndichienda. Yes. Ex- exactly. That can also, we can also say experimentation. I want to experiment. You know how easy, I love the example that was given by the good doctor about Soldier Love. I listened to his music a lot. Why? Because when I was at Harare Hospital, I had this other client who loved Soldier Love to an extent which I was like, you know what, I actually need to listen to Soldier Love and understand why he loves Soldier Love and why my client is always in hospital. And then you listen, one of his songs, Anonga Chiti, Vanondigira Bones Nekondo die, something Codain, my boss, something, along those lines. Most of his songs are like that. These are the songs that our kids listen to. Not necessarily, and it's what in Amuruku Vateresa. As when I chapinam kombi, apinam komba chanonza Soldier Love or Killer T, and these ghetto youths, Pakaita the rise of looking for the word, I forgot it. An educated friend of mine gave me that word, Ratiza, but anyways. But there is a way where dancehall has been made in such a way, Yakuti, it's a clique, right? Exactly. It's more like a clique now, where you have to fit into that particular group of people or into that little nation of theirs that they have created. So that's also something that can also happen with our kids that we're actually trying to what? To prevent or to avoid. And the other point that I loved when I was trying to look around mental health problems that are caused by substance use disorders. The first thing they said was alcoholism is the most treatable disease but is left untreated. Why? Yes, thank you. Thank you. Social stigma, right? Yes. Perfect. Thank you, Chidem. Yes. It's actually very true. It's actually very true because I had an article where I read it a long time back. What she's saying is very, very true. Kuti sekuru vake vaidaiso vamwe vanotointroduca vana kuti no, it's very normal at the age of 8, 9, 10, 11. It's normal. I will say it was normal because when my grandfather, one of my grandparents passed away, ndakangona takupiwa, you know kachi my 7 days kekumusha, yes, he was a sabhuku ikoko tukupiwa. And then I saw one of my cousins in it because now of religion and itika dagango itoshe, right? But I have a cousin of mine, akaridza ngoma musi iwoyo. I have never seen him like that. Akapedzisira angozorara akadai ndopakamuka ari. And he was younger than me, 4 years, so I'm assuming he was around 10. You see? And it was very normal. Hapana kana munhu anakambomubvunza. So that's why I'm saying kuti what she said is a very, very important and integral part of alcoholism and how it starts. Because you might not do or take my drugs actually, but because at that time, if my parents would have said, Vana vangu avadaro, right? I had to spit out because I knew kuchurch kuti ndakanzichi, I'm not supposed to take. But what about my cousin who didn't have that particular background, yokuti anoti inonzichi, he can take the drugs. So that's a very valid point also. Yes, thank you.
I think the other problem with alcohol is medical professionals of the world make it seem like you should drink a little alcohol is good for you.
Yes.
So they say 1 glass for a woman a day is good to prevent heart disease and stroke. 2 for a man is good enough. And total abstinence can increase the risk. So people end up drinking because it's kind of, they are encouraging. Because if the authors of the medical books are encouraging, but the challenge now is most people don't drink 1 or 2, they drink more and they drink.
Thank you. Do we have any other contributions? Any other contributions? Yes? No? Okay. I'm now moving back to her point that she made on it was on denial, right? Yes. On denial, the other aspect that also comes in is intellectualization. Have you ever seen people who drink alcohol? Mane my aunts, and but this person is very right. So intellectualization basically is where we are saying the person knows. In therapy, we have what we call insight gaining, right? The person has insight on what the drugs can do to them. They know what the drug is, the mechanism of action, where it goes, how it acts, the side effects of the drugs. They will tell you everything. But what they lack is emotional, like an emotional aspect of, or emotional insight. So with this type of people as well, it's very easy for you to move up aside. And if you're not firm and with whatever you're doing, it's very easy for you to get swayed. Yes. Okay, so also the other part that I wanted you to know before we move into the laws that I wanted us to discuss about is that it would make sense when we're now looking at the laws that relapse is a process. It's not an event. I used to take alcohol, so now I'm now taking alcohol again. So relapse is a process in the sense, remember when Dr. Manenji mentioned that you need to understand that there are 3 factors involved when you're looking at drug abuse, right? You need to look at the drug, you need to look at the environment, and you need to look at the individual that you're talking about at this particular point. So you need to look at the drug. The drug in this instance can be cocaine, marijuana. You need to look at fuko. Why is it that this person why is it that this person is taking fuko? Why is it that this person what you call it, pampas to do drugs? So then that makes you understand the person. Why am I explaining in detail? Because like you said, therapy is very difficult and expensive. It's actually very expensive. So at times you need to be able to see these things before they happen in the people that we have around us, in yourself. You need to understand what is going to be happening to you, to your loved ones, to your children, whoever it is that is around you. So you have the drug. The environment now, where we're coming in, like he said, he explained the issue on sometimes at work. If I'm an anesthetist, it's easier for me to get fentanyl, pethidine, I have access to that. If maybe I once had an operation and now I have the money, I can also get access to those. If I don't have the money, now there comes a point where I'm like, okay, fine, I can afford the pfuko. So if I don't know how they do it, but if I wait for a couple of days, straight actually 7 days, I can have access to the alcohol that I want, right? So the environment that you're talking about also can be in line with who you're hanging out with, where you spend your days. What type of environment do you think also would we be talking about in this particular instance? Environment, if I have left any other points that you think might be very important in explaining the environment. Any points? None. Okay. And we have yes. Exactly. Is also at a higher risk of actually taking or consuming the drug. And we have the individual. So the individual is what I want us to deal with today. Why am I saying we need to deal with the individual first? The individual is the one who is in charge of how they view. Remember, we said trauma is how you view the environment around you and how you respond to what happens to you. Right? So the individual now in play is you. And you're coming to yourself, you're saying, am I enough? You're asking yourself trauma-based questions and all the likes that we had talked about in the morning, right? So we have the 16 laws of a what? Of a happy mind, or if the name you can call it whatever you want, but these are the 16 laws of a happy mind or a sound mind. So the first part that I wanted to describe in the morning was the mastermind. Does anyone remember what I was trying to say when it comes to the mastermind? The mastermind. The whole is greater than the sum of its parts, right? So now we're explaining the mastermind. So we have the whole, and I gave the analogy of the table. So the table in itself, like this, is greater than what? Than the parts, the leg, the frame, or the top part of it. So if I just have the frame, I don't have a table. If I don't have a table, and if I just have the top part of the table, I do not have a table. Right? So the mastermind in this aspect is coming in to say where two or more are gathered, right? Where two or more are gathered. That's when you have the creation of the third mind that we call the mastermind. So have you ever noticed when you're trying to create something, maybe it's a plan, let me take for example, and you're trying to create a workout routine for your clients, right? And then you just create the workout routine on your own and you think, okay, this is the best workout routine that I've done all my life. And then you come to me and I'm like, but your quads, just through, you get it. Or I'm like, but you're not working out the calf muscles. You get it. So now, this has now created an opportunity for you to come in and say, okay, fine, I now need to work out on what? On the calf muscles of this particular person that I want to work with. What this has done is, the mastermind in this aspect is saying you need to have alliances. You need to create alliances with people who you can trust, right? Who have the same goal and the same mind with you. So the first thing that you need to do is create alliances with people with the same goal or same mindset as you. So how do you create an alliance with the people who have the same goal or same mindset? Also, I remember when we were talking about at lunchtime, the type of people that you actually choose to hang out with, your spouses. You need to make sure, Kuti, you also are in a situation whereby you rope them into your particular thing that you want to do. So right now, at this point in time, we're saying, Kuti, you want to create a better mindset for yourself, right? So if I come, like I said, I gave an example, Kuti, you can say to someone, you need to be physically fit. And that person would feel they're not physically, if they become physically fit, exercise matanga kana zvimakranchi zvenyu ana mazvi ko zvamuri kungojoga muri kumhanyiswa here, you know. So already in this aspect you have lost the motivation that you would have gotten from someone who would have supported you in whatever it is that you're doing. So the first thing that you need to do is to surround yourself with people who understand what you're trying to do. And what is it that you're trying to do? That's a definite chief aim. What is a definite chief aim? Right. Pane vakamboendawo mumabhota ari around town, tumabhotibhoti, tumakanu. Right. Uruda usvika kucorner ukoko, right? You need to roll to get to that corner. If you move in a certain direction, nemuna ari paside pako akamove in a certain direction, you go straight, or you turn left, or you turn right, right? But if your chief aim, or your definite chief aim is, all right, actually, did you understand the mastermind? Did you understand the mastermind, the site? Any questions before I actually move on? I had moved on too quickly. Do you understand the mastermind? Yes, a question. It's more like, it can be a support group, but it is actually a group of people who have the same goal. So sometimes I don't want the term support group, because support group sometimes can mean people who are just supporting you but are not in it. These are like-minded people, right? These are people who have the same goal and the same vision as you. So if you have someone with the same goal and the same vision as you, it's easier for you now to actually move within that within that vision. Also, you need to be actively, it's easier to move with someone who has the like mind, in the sense that in this particular aspect, I'd also forgotten to actually tell you that you need to be constantly thinking and talking about it, having meetings. So the mastermind, basically, it's like a meeting that you have every morning. I know doctors have ward rounds, and so you can have a doctor, a psychologist, a therapist, a nurse, right? And you have other people there, right? So what this now does is, if you have the people here, the chief aim that I am now going to explain is the patient. The patient has to get better, right? What has happened? The patient has a fracture, right? How did the patient get the fracture? There was cheating. So already now you need to understand, okay, fine. There is this problem that has come because akabatwa achichita. But this person needs to go back akabatwa achichita. That's their home after they have left the hospital. So what are we supposed to do? Now, number two, the doctor arufana kutrita the fracture before paita any problems or any or stuff like that, and actually treat the fracture. Now also, you have the therapist coming in and saying, okay, fine, we now need to be able to put this hand. Do you see how important it is to now have people who have the it's a like mind. You're not necessarily doing the same thing or the same function, but you're working together in what you're doing. So this example is very important in the sense that if you have people that you work with, right? Like you are saying that you have a group here that talks about physical fitness, right? So that group, these are like-minded people. Not everyone jogs, right? Some people squat, some people walk, some people do whatever it is that they're doing. But the main goal, the definite chief aim that we have is the working out aspect. Make sense? Okay, all right. Now the definite chief aim. So a definite chief aim in this particular instant would be your purpose. The main purpose, like I was explaining, to say, it's the purpose that you have to say, this patient came in here, these are the problems that we have. So we need to find what are the things that we need to do for this patient to be able to what? Exactly, to leave the hospital and live the same life that they were living, or actually a better life, right? How is it that we need to avoid this patient from getting into this same problem? So that's now what a definite chief aim does. So also, what a definite chief aim also helps, I was giving an example of rowing a boat in that direction, right? Sometimes as doctors, unogona kupa patient uchifunga that this is the right diagnosis, right? There's the ruling out of problems and ditika. Sometimes not munu depression, not going in this direction, right? So a definite chief aim helps you or assists you in the point that it shows you where you need to go. It doesn't necessarily move you in that direction. You are the one who is moving towards that direction that you want. So when you are moving in this direction, like we're saying, be kind to your mind. You're constantly or actively doing something. Like There's this other example. Oh my word, I wish I had brought a hanger or something. So, have you ever seen something per hook? Chihook chache pa bathroom check seri kwedo church. And if I put something there, ndikadai so achieve, right? If I try kufamba ndichidai so chiripo chakahuka, it doesn't what? It doesn't budge. It stays there, right? So these are what? That's something. If I'm supposed to go this direction, right? And this is pulling me in this direction, right? This particular hook is pulling me in this particular direction. That means that I am moving away from the values that I want. So we are supposed to be moving in that particular direction, but you are hooked to a certain experience or a certain feeling or a certain thought, right? So that hooking then also removes you from your definite chief aim that you have. I hope that makes sense. Make sense? Perfect. So that is what? A definite chief aim. So you need to know what you want before you start what? Your process or your journey to say, I want a better or sound mind. Before you start, you need to understand, okay, fine, what is it that I want to do? Then you have your particular purpose. Any questions before I think of moving on? Any questions? Kunyarara kuti hapana ma-questions kana kuti hapana chamanzwa. Yeah? Kana kuti kuita mwana waticha kwakanaka. Okay, so and then the third one. Can I move on to the third one now? Is it okay? So the third one in these laws that we can have of creating a healthy mindset within yourself is self-confidence. Right? Self-confidence, I'm sure people can explain. I just need an explanation, a basic explanation of what self-confidence is. Self-confidence. Dr. Manung. Yes, thank you very much. I just felt like doing that. I'm so sorry. Okay, self-confidence. Anyone else? Ardaku Edera on what he has said. Yes. Exactly. Thank you. Last hand, if we have any. None? Okay. So self-confidence basically is the optimism that you have in yourself that I can definitely do this, right? But self-confidence also, like I have been explaining, can be borrowed. Sexually transmitted disease. Have you ever seen when someone who's very energetic walks into a room, and then everything just becomes gloomy, right? So self-confidence also is important. What's also important in this is who you surround yourself with, right? Who you choose to surround yourself with. The more positive people you choose to surround yourself with, right, the better it is. Is it the AY Legion of Honor, right? So sometimes the AY Legion of Honor is for me to honor Christ in all that I choose to behold, honor Christ in the choice of associates that I choose to have, right? But this is important in the sense that it gives you self-confidence. If I'll give you an example of how I started the Compassionate Couch. Yes. I didn't want to do it, but I was just like, you know what? I used to do 1, 2, 3, but my friend, she's not even here. She's in Cyprus. She was like, no, Margie, you're so good at this. No, try. Just give it a, like she was so persistent and so positive. Everything that she said, even if right? It was not even working. But the amount of positivity that she had and the amount of belief that she had in me, right? So this is also important in the sense you need to be able to recognize people who can give you a positive outlook of your life. Have you ever met those people who are always saying, upenyu wakaoma, nditombonaka kana dhola rechakati kana zvikazodai so like nothing seems to be going right in their life. Imagine how that would also then affect you as a person. And I love this other part that is called auto-suggestion. At times you don't need to wait for someone to come to you and then explain to you that you're good at this. I'm the one. If not me, then who? Right? So this is the law of auto-suggestion. The law of auto-suggestion, it's still within the law of self-confidence, sorry. But it's called auto-suggestion. So where auto-suggestion is, you're constantly driving a point home to say, I'm a very good public speaker, I'm a very good public speaker, I'm a very good public speaker. I was not a very good public speaker, by the way. Fun fact. Did Form 4, right. Takaenda ku words. I was Form 2, between Form 2 and Form 4. Form 2, Form 1, Pathfinders, somewhere there. We went to Wedza and ndakakrema inonzi speech yangu. Ndasvika pastage. I don't even remember what I was talking about, but ndakakrema word for word. Word rovaratiza. Word rovaratiza. And then I'm just there. And you know, turu kai papa pukanonga kutanga develop all my feelings, my crush, what or not, akakadaka kamkomanaga. But then you're just there, right? And now ndastika kamkomana kai kandiri kufarira kakanditarisa ndastika. So now, ndakangobuda dhora riri apa, ndakamira panamo. Hava nangomhanya ndobva ndabuda panze ndobva ndatanga kuchema. Luckily my mom was there that day. I don't know what would have happened. I don't think I would be speaking right. I don't think I would be speaking right now, because she then told me and then she taught me, right, to say it was just something, it just slipped up, right? It happens in life, but you need to tell yourself that I can do this. Each and every single day that you are there, I can definitely do this. So that's the law of what? Of auto-suggestion. You are tricking your mind. Your mind is what you feed it. So you're coming in and you're tricking your mind that even if it's not true, I am a rich bastard, even if it's not true. It tells your mind to think from a rich bastard perspective. Yeah, that's what I usually tell my mom. Like, I'm a rich bastard. What do you want? Papa, no gosh, that $2 cooking oil. But that's what the law of auto-suggestion is, right? On self-confidence, do we have any questions on self-confidence before we move? Yes, thank you. There's this verse I'm forgetting. Yeah, the creation of pathways in the Bible. It's not as a man thinketh, so shall he be. You may go to your thoughts, then create a path that you move within. But really very, I think like I on Mark Finley or something along. He has a book along that, along those lines. Inini zvangu personally ndinozongoitawo zvangu kuno kuti mbijana, but you need to ask my friend how pompous I am when I'm in front of her. I'm very pompous. I'm like, haunotombondiona shamwari zvanandiita, and then I'm joking, but anyways, I think there's this aspect, this part of the brain, which is called the amygdala, right? So I want to give an example. I'm trying to look for, has anyone ever played Jenga? My blocks, ekubisaya, kudai, then we sabamsoro. Do you know that game? So it's like it's a tower that you have. It's like a skyscraper thingy, but of wooden blocks. So you take a wooden block out from a certain point, and you place it. So the more it can go as high as it can be, but if you make wrong moves, it falls. Or a wrong move that you make, the next time you try to pull something out, exactly, or you try to place it because it's unstable. I'm trying to give this answer to you in the sense that the brain knows what you tell it. So if I say, that is what you have told your brain. If you're telling your brain, mbijana, that is what your brain will store, right? So in each and every move and statement that you're making about yourself, even if it is a joke, right? Your brain comes, the amygdala knows no joke. It just knows, that's the next thing. That's why we now have those traumas and anxiety. That's why that is the building block of anxiety. So you notice that most of the time, because but the amygdala, but the amygdala, like I'm saying, is the part of the brain that is responsible for that. So as you move, whatever it is that you tell yourself, that's what your brain knows. And you're creating pathways, like I was saying. So if every day I'm moving, I'm saying, bijana, and I move in this direction. Next day, bijana, and then I move in the direction, oh, I'm useless, right? Remember, our goal is going in that direction, right? To where our definite chief aim is. So what you're basically telling yourself is, and that's when you see it's now harder for you as a person. I will not say maybe that's the reason why we are still backward as Africa, but I'm not sure. But that is where it starts. I once read a book, right? Have you ever noticed how arrogant business people are? Meeting. They're like, no, I can give you this and give you that. They lie. And they overshoot things. 90% of them deliver, right? Because their brain knows, Guti, we can do this. We can do this. They keep telling their brain, we can do this. That's why you now see people, why? Because they have been telling themselves, Guti, they are the person. They are the man for the job. If someone comes to you at your workplace, right? I tell people, no one is faster than me when it comes to doing this, or more efficient than me when it comes to doing this. If I know I'm good at that, I am good at that. Full stop. I am good at it. I am not good at this, guys. So can you please help me so that I can be better at this? Anyways, I hope your question is answered, but the more you tell your brain that you cannot do it, you won't be able to do it. And I think also this also comes into play when we're now looking at initiative and leadership. Where initiative, right? Like, I liked your question that you gave. The initiative is, no one is coming to save you. No one is going to come and pull you out of the water if you're drowning. I learned this the hard way. I am asthmatic, and when I left my mom and dad, I was so used to 2 a.m. If I just start wheezing, my God, everything is now out of my hands. What I just need to tell them is, I'm not well. I move to Harare, I stay alone. I tried to call someone, anongari busy in life yake. I tried to call someone else that are busy in life yake. No one can come, no one will come and help you. Hapana vanhu vanozouya kukana kwakurufu chete ndopo vanozodhiraivha kuenda kwaMutare kuti munhu anovigwa kana vanoti handina mari yefuneral parlour ndopo vanozotanga kuti tine mota saka sechechi ndatibatanidze mari asi pendai kufanira ndichiti ndiri kurwara. No one came, right? So initiative in this aspect is no, don't feel bad, but initiative in this aspect is I need to be able to tell myself or to see kuti ndakuzaridzwa. Fun fact, nezuro ndakabuda muhospital kuma 9 p.m. because of an asthmatic attack. Ndakasvika kumba na 6, I was fine. For someone who works at a hospital, I was like, I'm fine the whole day. Ndatobva kubasa ndakuenda kumba. I get in, I try to sleep. I can't sleep. So I noticed I couldn't sleep because I can't sleep on my pillow. I needed to put like the super big pillow, to my pillow to diki to triple for me to be able to prop myself up, and that was a drama. I stay alone. 2 a.m. hakuna magets, ndotry kutsvaga water for injection yangu kuti kana kane blaze kangu zvikazooma andisithi yakaiswepi nemunhu anondibatsira kucleana mumba. You know what? I can still drive. I'm going out. The only thing that I could do was call someone who stays close by my area to say, where can I find a hospital for my medical aid? Chat. Because I couldn't go back, which it was now far. So I needed to find a hospital that would accept the medical aid. So that's initiative. You need to understand but you can still drive 10 minutes away before things get bad. Because you know what, this is still somewhere here. I'm giving this example because this is something that relates to me and it's easier for me to explain it. But this does not necessarily mean it has to be something that is medical. This can be something that can, business child, people will be like, zvakaoma, handina kana mari yeti. Wobvunza saka uri kumboitei? Hapana ndiri kumba. Uri kutengesa madomasi here kuti tikutengere madomasi? Because my mom told me kuti nyange wakaremara unogona kusakura kana kudzura masora. Right? I grew up asthmatic and I was taught to do things, right? So that then comes to the point where you're saying, you are in this particular situation, you need to find and initiate or make the initiative to remove yourself from that situation, right? Any questions? Initiative? Not really. Yes, madam. I'm joking. Yes, question. Grading. It's grading. Let me give an example. Because issues to do with people who have mental health problems are very subjective. So if I am to say, ndoda kuti uite initiative yekunoenda kunonzi, what do you call it? Kunotengesa madomasi for someone and a mental health problem, that might be too much, right? Initiative, what do I mean when I say grading? Grading is a way or a tool or a method that therapists can use to assist the patient to have mastery, proficiency, and increase their self-esteem. So when I was explaining rehabilitation, to habilitate is I have just come semwana ndaiziva kuti ndokusimudza musoro ndozotanga kurola ndozoita zvandinoita pobva pauya vana vane cerebral palsy, right? So to rehabilitate, or these ones need to be habilitated. So rehabilitate, let me take munhu ane stroke, easiest example. Aimbofamba. Now I need to teach this person to be able to walk again. Right? That's rehabilitation. So it's something that they used to do. It used to be a habit that they used to take part in. But because I had a stroke, vanhu vane different levels of stroke, and that affect different parts, that cause different problems, even though inogona iri left-sided, right-sided, whatever it is, and cause different problems within different people. Different behavioral problems also then are seen with people like this. But unofanira kunzwisisa kuti, have you ever been, I'm giving stroke as an example. Panotanga munhu we-stroke, first time anonga achingotanga achingobatwa ruoko. Next time anonga akadai, a therapist akadai. ari kuita guided touch. The next time akuita ega akuisa 1. The next time ari kuisa 2, right? So that's grading. In the sense that these are just, all of this that I've given, even the definite chief aim. A person with a mental health problem, anogona kutotadza kuzoti this is the definite chief aim that they need to have. These are the people that I'm supposed to surround myself with, right? But if you then come from a perspective where you're saying you need to know that these are the things that you need to do. I'm sorry, I'm going to use you a lot in my examples. Hautangi 100 masquat, unotanga 5. The next day, womboita 55, womboita 7, womboita 9, wombotoka futi pa 5. So that's how you can help someone like that. So this is just something that you know, kuti, you want this patient. I'm going to give you an example. Munogona kuya mondipa ma pills, right? And mona kuti arikuto koza more harm in the dosage iri pamsoro. You downgrade the dosage, right? Because I need to have those pills. Because my side effects and shakuto defeat the purpose. Then you reduce and it starts working slowly. So that's how you can then come to a person and a mental health problem to teach them how to have initiative, to teach them how to be the own leaders of their lives, to say, Kuti, I need to be able to do this so that I can get to that point. And it's not a straightforward journey. Kuti, first, someone initiative. Sometimes you need to teach someone something at the very bottom, right? Sometimes women are not in initiative, but they just need assistance to get to that particular point or to understand this is what they want actually. So, are you answered? Oh, yes. One thing that you have to understand about people vanoita futi drug abuse is it's very frustrating. Remember, I mentioned the issue of relapse. That relapse is not an event, but it's a process. Right? It seems as if you have taken 10 steps forward, Mashika Ok, but then the person moves you 12 steps backwards. Pakatotangira muri patova wes, akutotanga kutoba. Dola racha asuchatomira kuti rishike, akutotanga kutotasa kuti mumba mune chicha ndogona kutora so that I can be able to use it. So I think also it's about the environment that you create for that person as well. The environment in the sense that if you have a person who has a substance use disorder or a substance problem, right, you need to be firm. But you just need to be firm but empathetic. Because what happens most of the times is when we get frustrated, we act on emotion. And when we act on emotion, we lose the plot. And I usually love to say you need to be able to separate the sin from the sinner. And that is what happens with alcohol abuse. And one thing that you also need to know is most of the times, most people don't get over the what? Obviously, we move or advocate for total sobriety, but sometimes you never get to that point of total sobriety. So if you're going into rehabilitation with someone where a substance use disorder or a substance use problem, right? You need to understand you might not even get this. So that's why we advocate for prevention. Asatombotanga in the first place. This has happened, yes, but because some people do get there, but relapse is a process that can also come back because one thing we have to understand, like we're saying, to the environment that the person is living in. If the environment right? And then I go back into the environment where I can't get a job and I'm still unemployed and I still hang out or I still have access because easily accessible. I am I might still, I'm not saying I am going to, I might still go back into that particular environment and start taking drugs again. But then you need to be able to then realize and be supportive, right? How do you then become supportive to someone who has these problems? Yes? Mm-hmm. That is very true. That actually, I feel since we're still talking about this, let me move and kind of skip so that I go to cooperation. Where cooperation, like they're explaining, right? Cooperation needs you to understand from Dr. Manungo and Dr. Maneji is the use or the acceptance, sorry, that there is a higher power that is there, right? And cooperation in this aspect is more like a teamwork with God, right? You need to have that teamwork. I am not going to explain it a lot because it has been explained, so I figured it would be easier for me to actually just throw it there as one of actually the processes that you can actually use, right? Dr. Maneji rightfully explained it. And cooperation also, we can then come to the cooperation of the family. And like she was saying, Promise was saying, Kuti, they were cooperating with the person. It was more like a teamwork that they had. And one thing that I actually want to say is what you're doing is very good. Being there constantly showing that you are there for that person. Even though physically it seems as if you have moved 10 steps backwards. But trust me, when you then move from wherever you are, sometimes it seems as if you have moved 10 steps backwards because of frustration. Because you have thought kuti tadarika izvi. So seeing it again is kind of like it's back to zero. And have you ever played Snakes and Ladders? The original one. Yakubvisa pana 49 wakusvika pana 50 yokuendesa back to start, right? At times, have you ever noticed at times waiti ukarumwa nenyoka yapa 11 inokudzosera pazasi, unofila kunge warumwa nenyoka iri kubva kuna 50 ichikudzosa kuna start. It was just one snake, right? But all other snakes felt as if wadzoswa kumashure and watonotangidzisa, or maybe wangori pamberi stereke urofana ungoita one more move and wasvika, right? So I think also in that particular aspect, the snakes and ladders analogy would then help you to say, okay, fine. At times you are going to get hit by a snake iripa 49 or 48 when you are 2 steps away from 50, right? When you're saying that this person now has a job, they can now have a stable income, they can now look after themselves, they won't be stealing. And now planet the issue because with drug addiction, one thing that we also forget is you can find this patient kuma fractures, kuma accidents, unogona kumuana ku jerry. You can find this patient anyway, right? Anogona kuita diabetes, anogona ngana high blood pressure. There are other things that come. So this patient we are tiskungoti urukumutritira uri munonzi muchi uchango detoxify. Maybe now there are other problems that are now coming in because of the substance misuse here. And that's where the teamwork now comes in and the cooperation. And what you need to understand, I think it's a hard truth. When you understand kuti this person is going to disappoint me. I expect a disappointment like, right, anything can happen right now. But anything can happen. Next weekend, it helps you to accept things. What will move on, right? So I think having that same mindset in understanding Kuti, it's not your fault. It's not the person's fault. It is the fault of the illness that they have, right? Because if you take drug abuse as if it's just drug abuse actually is an illness that can also lead to substance-induced psychosis, substance-induced disorders, yes? Mm-hmm. And then nothing is done. Right. I think Dr. Manungo Vambotara Pango actually like the jet fuel detoxifying, munu are intoxicated already. So just removing them. Chakafane kungo bvisa mwana pamukaka. Mwana ne strategy kubviswa pamukaka very different obviously. There are different strategies that you use kubvisa mwana pamukaka and it's the same thing. Because mwana already in this aspect we are saying are addicted to breast milk because that's the only thing that they know. So just removing from drugs can actually do more harm than good to the person. So that's when you need to find kuti the drug that they were taking, understand its cause, action, and stuff like that. Then the doctors will tell you kuti this person another 1, 2, 3, 4, 5, so that we can remove the drug from their system. Jiri safe. Any other contributions, Dr. Manenji, so that you can further explain? Yes. Serafita, yes. Yes. Yes, before Dr. Manungo speaks, I actually wanted to respond to your question by adding on to what she has said. There was a youth program that we had with Mount Pleasant Church. Patakaita Paipai, right? I didn't know most of the people, but then someone then came to me and then explained it's not necessarily going with verses when we say come to Christ, right? Sometimes, like she's saying, it's just visiting or it's just having those programs. There was a youth program that was done Kumusha Resort. I think that's the program that Mount Pleasant and City Center were together. I had someone come up to me, she said it publicly and said, I was lost. I was dealing with mental health issues, and she was now starting to try to use, like stuff like that. But because of the love that she saw and the acceptance that she got when she came to that particular social group, right? So this now is also in response to the type of environment that a person can have. Abantu Kutara is something that actually, that I know worked, that has been done by this church and my church, right? Something that I know Kuti, we are saying Kuti, someone needs to come to Christ. Sometimes we undervalue the aspect of prayer, we undervalue the aspect of fellowship, right? Most of these problems came because Takaita COVID, we were now on our own. That's when we had a pandemic in terms of drug abuse, and we needed to do more drug awareness campaigns, right? Some of us, we didn't do drugs because we were always constantly at church. Every day, Monday to Friday, I'm at work, so I don't get the time. Saturday, I'm here. Sunday, maybe I'm now preparing so that I go to work on a Monday. And sometimes that's when you have those activities that have been created for the youths that now remove me from that particular environment and slowly start nurturing me back into the society, or reintegration back into the society. So I believe that reintegration, I know it's very hard to say that the person I'm Ari Pathfinder director, Ari this, Ari that, and it's very hard for you to come to that person, first, right? Sometimes you just need, like you're saying, to show them love. Sometimes you just need to show. This is one verse that I love. That's Galatians 5:22, the fruits of the Spirit, right? You don't need to tell them what the Bible says. Remember, I said one of the problems of people who take drugs is intellectualization. They know. They know. So what you're now basically dealing with is the emotional insight of this person. So the fruits of the Spirit, it's Galatians 5:22, the fruits of the Spirit is love, joy, peace, long-suffering, kindness, goodness, faithfulness, gentleness, and self-control, right? Have you ever seen when a baby does something? Because right now we're just saying they've gone back into their primitive state, right? They have gone back into a stage when they're now taking, they're addicted to something, right? They've gone back to like a childlike stage. Have you ever seen that when ukatsura mwana some type of way, in another way? If you tell them, can you please stop doing this in a way that they know, they feel safe, the next time, mama chaka chaka, and then they stop doing it. But ukashika ukaramba, I'm not saying vana wafana kurowa, but ukangot everything chaita, wanonokomuka ndakurova, waita seso ndakurova. Anything that they do, the first response that you have is negative. What you're going to get is a child who knows negative responses. But if every time that they do something bad, I know it's hard for you. I understand that this is hard, but we need to get help for you. So you have been firm, but you have acknowledged that the problem is not with them. I know that you are trying as much as you can. The last time you came, validate the actions that they did. Positive reinforcement, like Dr. Manungo was saying, and Ditika, Yema stickers. I know that the last time you came, you wanted to get a job. What went wrong? Let's discuss this, right? You have also to remember there's what we call humanitarian approach and humanism, right? So humanitarian approach, muna rice, rice, right? I give the person rice. So the humanistic approach basically comes in and says, muna rice, how do you think we should get the rice? We need to work for the rice. How are we able to get you to work for the rice? What you're doing is you're instilling, remember we're talking about the laws of success for a healthy mindset, Handitika. So now you're trying to instill these little laws inside to say, okay, you need to have a bit of initiative. So instead of me just coming and saying, no, urufana kuita ich, ita chakat. So that's you trying to be supportive, but you're understanding, Kuti, you're firm, but you're empathetic. You're understanding that the problem is the drug and not them. What happened has happened already. It's now water under the bridge. It has happened. Now let's deal with the fact that we still want this person back. Dr. Manungo had his hand up before I interrupted him. Yes. All right. So I think we can now move on, right? The next point that I wanted to also bring about when you're trying to create a healthy mindset is imagination. By imagination, what I basically mean is this. There's an example that was told, right? So a certain gentleman wanted to buy land, but there were two pieces of land that were available. So one was Mugomo, Rakabakazara Matombo and rubble and stuff like that. And then the other one was very much below sea level, right? And the land was going for peanuts, right? So when he went and bought the piece of land, two pieces of land, where people had actually written them off, you know what, but it was not prime real estate. I'm sure you understand, right? The person went and bought, blasted the mountain, right? Moved with the rubble from the mountain, right? And dumped it where? In that land that was more or less below sea level so that it could rise. Why am I giving this example in this particular aspect of imagination? This person used their imagination to say, all right, Panapa, I have two problems that I have. So the first problem is I have this mountain over here, and the second problem is I have this valley over here. How then do I get this land to be level? Blast the mountain and dump the debris where? In the valley. So this basically, when it comes to imagination, it explains to you how you are coming in and saying, okay, fine, imagination helps you to see two problems. Problem one, problem two. What we're dealing with here is you're getting into substance abuse, you're using drugs because you see problems. You see a lot of problems. But sometimes if you take a step back, look at your problems, you can then see the solution within what? It's more like a bird's eye view. Have you ever noticed, and then you tell someone else, right? So sometimes look at the problem as if it's not your problem. Right? Just take a step out of the problem and start seeing it for what it is. Before you start saying, I want to use drugs, I want to use alcohol, I want to use the guka and mutorido that then comes. So that's how your imagination in this, obviously, like I said, this in terms of imagination and problem solving, you have to grade it. Different people are at different stages. Someone can easily come and say this mountain can just be blasted. Right? So what I'm trying to say is, if you have someone or if you're someone who has this problem, you have to start small. Build your imagination, build yourself to say, I need to be able to do this. I'm going to give an example. When it comes to imagination, I'm going to give the example, Elijah and the widow's oil, right? If you look at the story of Elijah, right? He asked the woman, what do you have? She said, I have nothing but a little oil, right? So already as you're looking at this, you see the negativity within the woman's statement. I have nothing but une ndine little oil, full stop. What's the nothing for? Right? And then you then move on, and then Elijah then starts saying, okay, I want you to go to what? To your neighbors. And I want you to borrow some jars. And I want you to close your door, to go into your house with your children, close your door, and then fill the jars. Right? What Elijah is doing, like I said, with imagination is he is assisting this lady, right? It's more like he had graded this. Hasi achanozofamba achinokumbira jars for the oil. He was not the one who was going to fill the jars of oil. He was not the one who was going to be behind closed doors with the woman with the jars of oil, right? But in this particular instance, when you're coming in, you're saying, close the door, right? So let me give an example of how we can actually relate this to our day-to-day life when it comes to the story of the widow's oil. One thing that you need to understand is you need to look for as much help as you can. Like my dad used to say, the woman could have looked for more, because if she was looking for more jars, it meant there was still space in the house. They should have locked the door when the door couldn't be locked. So it means if she was looking around to see there was still space in the house, right? But we are saying in this particular instance, I'm not going to judge her in that regard. She worked within her capabilities, right? And you see how when she then asked, the question she asks her children, do we have any more jars? When the children said no, the any more jars now means she's seeing her challenge or her problems in a new light. And she's now saying to herself, I can do this. Do you see how because the constant pouring is more like repetition. The fundamental or the base of rehabilitation is repetition when you're doing anything. So if you're saying kuti ndanamata nhasi zvaramba, dzoka mangwana unonamata futi. Zvikaramba futi dzoka mangwana acho futi unonamata futi. Zvikaramba dzoka futi mangwana acho unonamata futi. If it doesn't work, still go back until you are 6 feet under. You still have the breath. Even if you are walking, at times anzina mama unogona kutoona munhu ari kudrive anonga achingomuvisa munhu machikuti. But what are they doing? They are praying. Let it be a constant in your life that you're praying. What prayer does, and you remember the cooperation with the higher self that we're talking about. We said that it is cooperation and teamwork. If you're cooperating and you're understanding that there is a higher power that can help this person. If God managed to help someone who had 12 years of bleeding, right? 12 years, right? It means, what is this, right? God is not man that he can what? Exactly. So that's one thing that we need to then come up when it comes to imagination. Imagination does not come from us. So I am bringing in the aspect of cooperation and imagination and merging it in the sense that imagination comes from God. The ideas that you have to help that person, right? The more you constantly pray about it, the more you constantly think about it. To say, okay, fine, I want to do something, right? I didn't just come up and say, right, I can take these laws from business and try to put my therapy things in them so that they can make sense, right? But it was something because I was meditating, right? I was thinking, what would make sense, right? What would make sense that I can talk to someone and they can understand that this is what you can do for you to help yourself? How can you be successful in creating a good mindset for yourself and a good mindset for your brother, or a good mindset for your loved one as well, right? This is the imagination that we're talking about. You need to be able to take different aspects of life, or different things, or different principles that you have, merge them, and then be able to sell that to someone else. I think that's with imagination. Do you have any questions? And I think it is now time up. Confirm. I think we are now done, right? Yes. Yes, 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 yes. The other ones, munoso mansko kumwe. Yes, a question. Thank you. Do we have any other comments? I think I am done now. Yes. It's yeah, true. Do you have any other comments, or we can call this a wrap? Do you have any other comments, questions? Yes. saw a hand.